This is Immuno Africa, a podcast dedicated to spotlighting African immunology research.
The first edition of the Immunology in Africa podcast graduate student series seeks to spotlight the motivations, journeys, and perspectives of African graduate students in immunology while highlighting their amazing contributions to the field. It offers our listeners an opportunity to explore and keep tabs on the inspiring works of young African scientists in the early phases of their careers, especially those keen on strengthening the continent's capacity for scientific research, growth, and development. For this first series, we spoke with 6 graduate students pooled from 5 African countries whose research spans a rich diversity of viral diseases, vaccine development, cancer, obesity, autoimmunity, and allergies. The stories told here portray self-motivation, initiative, resilience, hard work, excellence, consistency, growth, discipline, planning, and patience. These stories offer valuable insights and lessons to young and emerging scientists interested in building a career in immunology, as well as established scientists in the field. This time, we feature Dr. Marah Chibwana. Dr. Chibwana holds a medical degree from the University of Health Sciences and an MSc in Integrated Immunology from the University of Oxford. For her PhD, she was recently awarded the Rhodes Scholarship to read for a Doctor of Philosophy in Molecular and Cellular Medicine at the University of Oxford. Building on her MSc research, her PhD work will focus on understanding the factors that drive neutrophil behavior and heterogeneity. Findings from this study will contribute to improving the health outcomes of individuals living with rheumatoid arthritis and other autoimmune and inflammatory conditions. Marah strongly believes in the translation of basic medical science research. Alongside, she advocates policy formulation to overcome diseases and improve health outcomes both locally and globally. A passion for training the next generation of scientists is currently expressed through a science club in Malawi, where she mentors young people to pursue careers in science.
My name is Marah Chibwana. I am from Malawi. I was born and trained for the most part here. I am a medical doctor and an upcoming clinician scientist in immunology. So currently I am working with the Malawi Liverpool Wellcome Program. This is one of the leading health research institutions in Malawi. I work as a clinical research associate in the Infection and Immunity Research Group, which is headed by Associate Professor Cornell. A bit on my education background. So I did my primary school and secondary school / high school in Malawi. Following that, I went to the College of Medicine, now known as the University of Health Sciences, for my undergraduate degree in medicine, my MBBS, which I completed in 2018. So during my undergrad is when I became interested in combining my clinical work and research, following some of the interactions that I had with clinicians who were in the research space. I wasn't, at that moment, I didn't quite think of immunology until later when I finished my undergrad, when I was introduced to the field of immunology. So I completed my medical training in 2018. And at that point, I knew that I wanted to combine clinical work and research. So that's when I first was introduced to Kondwani Jambo, who has been my mentor and my supervisor from that time. So at that moment, after completing medical training, I had to do my clinical internship so that I could get my license to practice in Malawi. So as I was doing that, I combined that clinical internship with the research internship in immunology. And I did that until 2020, and that was around the time of the COVID-19 pandemic too. So following that, I became heavily involved in COVID-19 work and generating data that was specific to Malawi in terms of the seroprevalence of COVID-19. Following that, I then went on to do my master's at the University of Oxford, which I completed in 2022. This was funded by the Felix Scholarship. So I returned home last year, and around the same time, around September, I was also awarded the Rhodes Scholarship, which will fund me and support me to do my DPhil in cellular and molecular medicine at the Kennedy Institute of Rheumatology in Oxford. Yes.
Interesting. Okay,
so that's where I am.
Yeah. Yeah. So I think so when you mentioned that you took an interest in immunology research after, medical school. So I think that caught my attention first, because I think typically some of the persons I've interacted with, even myself, I became interested in immunology while I was in, doing my first degree. I studied biochemistry, by the way. So maybe you just tell us how did that interest develop, that you just felt like, okay, immunology is something interesting I should combine to my clinical training. Yeah.
Yeah. Okay, great. So during med school, I was exposed to some immunology, but not a lot. And I never really saw the laboratory and science part of immunology. But I think apart from that, what got me interested was that as a medical doctor, you usually see, let's say, 3 people who have the same disease or infection. One of them will have mild disease. I guess COVID is a good example. One of them will have mild disease. Someone will have severe disease where they're hospitalized. Someone would die from it. Someone recovers. And what really got me interested was that what determines your disease outcome, apart from everything else, at the center of that is your immune system. And I wanted to be able to understand how to optimize your immune response so that we're able to get favorable disease outcomes. So I think at the end of the day, everyone and every patient has a lot of immunology going on. And that's what I mean. That's why I was interested in it.
Yeah. Interesting. So basically, you're thinking of how you can explore the immune system to improve disease outcomes. So severe disease or severe response to a disease, and then there's mild, and then some persons die. So just make sure that everybody have the best outcomes. I think that's an interesting motivation for studying, exploring the field of immunology. So your master's was in the very interesting course, integrated immunology at the University of Oxford. So I had the privilege of having a recent guest. I don't know if you know him. He's a Nigerian, Dr. Ugu. So he's a veterinarian. So he also had his master's at Oxford, integrated immunology. So I think I've had 2 integrated immunology alumni on the podcast at the moment. So so what was so what was your master's program like? So what research did you do?
So my master's program was very interesting in that I think it was one of the programs, and maybe this is why I applied for it, that combined the basics of immunology and then looked at the clinical aspects of immunology. So the course was divided into 3 terms. In the first term, we did the fundamental basics of the immune system and how it functions and everything. And then in the second term, we now looked at the clinical aspects of the immune system. So starting from like pediatric immunodeficiencies, if a patient has SCID, what do they present with? To immunology of infectious diseases, TB, HIV, and everything else. Following that, I then went on to do a laboratory project for about 14 weeks. So that was, for me, I had wanted to do something different. So at that point, a lot of my work had been in COVID and in infectious diseases. So I wanted a project that was a bit different and offered me skills in working with animal models as well, because in Africa, we don't really get a lot of like biological units that have run a lot of animal studies. So from that, my PhD is actually building up on the work that I started during my master's in a way. So I'll be working with the same research group the Udalova lab at the Kennedy Institute of Rheumatology. And they're the same group that I work with for my master's. So for my master's, I was looking at rheumatoid arthritis and looking at the spatiotemporal characterization of a group of macrophages that are important in the development of rheumatoid arthritis, known as the realm alpha macrophages. Yeah, so I think that I've managed to continue building on some of the skills from my master's into my PhD.
Yeah, interesting. Okay, so your work was on rheumatoid arthritis, right? So basically, I think
Yes.
we should bring it down to science communication now and the common man. So based on what you did, so what contribution were you looking at making, maybe in the short term and also in the long term, to managing or treating the condition?
So in the what the main part of the project was to look at whether this group of immune cells, in this case, this particular macrophages, were able to, in a way, provide, reduce the inflammation that happens during rheumatoid arthritis, and so in a way be beneficial to the disease progression. In African settings, we don't really get a lot of, or rather, there's not a lot of work going on in inflammatory disorders, such as rheumatoid arthritis. We know that also because there's a lot of work, then we do not have a lot of statistics and data in terms of the prevalence. So usually the prevalence of a disease like rheumatoid arthritis in this setting is also quite low. Whether that's because it's really not there or we're not looking into it is neither here nor there. So, however, for me, I find it interesting because we do have a lot of other infectious diseases here that do create a background of inflammation. And in future, I would want my work to focus on the intersection between infectious diseases and inflammatory disorders and other non-communicable diseases.
Interesting. Yeah. So I think mentioning the fact that your work is exploring rheumatoid arthritis, I think is something really important for the continent, because I know until I got into the university and then I learned about autoimmune disorders, I never could have expected or thought that maybe arthritis or rheumatoid arthritis was related to the immune system, because over here maybe you typically see people going about selling different medications that will cure or treat rheumatoid arthritis. And so when I realized, I was like, what have they been selling? Because many persons would buy, it usually affects people who are kind of advanced in age. So people typically buy different kind of ointments and medications that they believe would treat or cure their arthritis. And so the fact that we are actually looking at the underlying cause and thinking of how we can develop effective therapies for them, and that you are looking into that, I think is really something that will benefit our continent in the long run. Yeah, so well done.
Yeah, that's true. Thank you.
Yeah. Okay, so I know you already mentioned, you've touched on, of course, how you feel your research would benefit the continent. So I don't know if you want to expand more on that, but I would pair it with this question. So perhaps you want to expand more on how you feel your study or your work would benefit the continent, and also connect it with what you are looking forward to doing or exploring more when you commence your PhD officially.
Okay. So I would explain it in two ways, in terms of the two sides to it, which is the current work I'm doing and the work that I'll do in my PhD.
Okay.
So I think the current work that I've been doing has also been very important for Africa and Malawi. So I mentioned that a lot of when the pandemic hit, I became involved in COVID-19 work. So while I know that like a lot of people during the pandemic were staying home and everything, I never really had a chance to stay at home or work from home because I was up and about with my supervisor trying to generate data for Malawi. I think that's one of the things that the pandemic kind of showed, where we needed data that was specific. So I remember the first projections that we saw was that we were going to be heavily affected. I remember for Malawi, we had this projection where at least 500,000 people or thereabout were going to be hospitalized or would die from the pandemic. And that was in the early phases. So we then wanted to find out the seroprevalence of COVID in Malawi. And that's where it all started. So the first part is we did a sero survey in healthcare workers, so about 500 healthcare workers during the first wave back in 2020. And what we did find from that was that although we were reporting a low number of cases as a country, but from that sero survey, we saw that at least 12% of our population had been exposed to the virus. So despite the low deaths that we're seeing, a lot of people had actually been exposed. So this thing was indeed circulating within our communities. So that was work that we managed to share with the Ministry of Health and also write up some policy briefs on. And I think from there, my work then involved to looking at the community. So that was firstly in healthcare workers, then I moved on, we looked at the community at large. Then following that, we looked at people who had recovered from COVID-19. So looking at hybrid immunity, because we also know that as one of the African countries, we had a bit of trouble getting vaccines at the beginning, but also getting people to then get vaccinated. So I had two problems, getting the vaccine in and then having people to go and receive the vaccine. But what we did manage to show was that for the population that we had who had recovered during the second wave, which was driven by the Beta variant, and then received just a single dose of the AstraZeneca vaccine, that vaccine was able to induce hybrid immunity in them, and they had really cross-reactive antibodies, which were also neutralizing other variants of concern. So moving on from that, so we moved from the healthcare workers to the community, to the recovered individuals, and now moving on, we're looking at whether there are cross-reactive tissue-resident responses that we can find in the lung of people who have been vaccinated or have previously recovered from COVID. So we know, and that's because we know that a lot of the work that has been done has been in the peripheral and our systemic circulation, but we want to also look at the site of infection, which is the lung, and the nose, which is how you actually get the disease. So rather the site of the site of infection and the site of disease. Yes. So I think that's really work that's important. Now moving on post the pandemic, what can we learn from it? Are there new targets that we can incorporate in like a future novel coronavirus vaccine, and moving on from that? So I believe there's still a lot of learning points from the pandemic. Moving on to my PhD work. So my PhD work would be focusing now more on inflammation. So I'll be specifically looking at neutrophils and trying to find out the key factors that regulate neutrophil behavior. And this is because there's been some work that has shown that neutrophils are not just one big group of immune cells, they're actually quite heterogeneous, and they're different morphologically, behaviorally, and functionally. So I want to find out what factors actually drive neutrophil behavior. And this is not only important for inflammatory disorders like rheumatoid arthritis, but also for infectious diseases such as malaria and pneumonia, where neutrophils are very important in the disease outcome.
It appears your experience, like research-wise, aside maybe grad school, is more on infectious diseases, COVID-related, and then, but in grad school, you're exploring more of autoimmune disorders, inflammatory disorders. So what's the overlap you see between your work on infectious diseases and your work on rheumatoid arthritis and autoimmune disorders? Yeah.
So the overlap that I see between like my background in infectious diseases and moving on to autoimmune and inflammatory diseases is at the bottom line is all these conditions have some sort of inflammation going on. And what I do want to focus on in my work during my PhD is to actually see how we can modulate the inflammatory response. So say we have a neutrophil, if we knock out one of the regulatory factors, how does it respond? How does that impact a disease, whether that's an inflammatory disease or whether that's infectious disease? So that's where I'm seeing that overlap, where I would really want to be keen on going back to what my initial goal is, to actually be able to modulate immune response and then get a good disease outcome.
Disease outcomes, yes. Okay, so basically you're not currently working in the lab, but I know you've worked in the lab. Like, okay, so you're not currently in a grad school lab. So let me put it that way.
Yes.
But yeah,
Yes.
so but you've been in grad school, you've worked in the lab. What are the typical experiments or the typical things you do in the lab? You can use any example, maybe from your current experience or maybe from your master's. But so what are typical experiments you run in the lab? Yeah.
So I can use the experience from my master's. So for my master's, the typical experiments were, firstly, number one, getting the samples from the mice that I was working with. So that would actually best be done in the morning hours. So first thing in the morning around 8 or 9, you go down to the unit where you then have the mice. So I was mostly working on knee samples. So it means with the help of my supervisor at the time from the group, would harvest, firstly go through the process of sacrificing the mice, and then harvesting the samples, which was at that point harvesting the synovium or the whole knee joint. And then following that would then process the knee joint, where you have to go through the whole thing to get it, either if it's for like light sheet microscopy, then you have to get it cleared, or if you want to use it for something like confocal microscopy, then you have to then decalcify it and all that, and then get it to a point where you can you have it in a block and you can get your slides, which you then stain for the confocal microscopy. Yeah, so that would be like maybe a typical day. So maybe do that in the morning. And of course, with that type of work, processing of the samples is not like a one-day thing. So you can start today and then you leave the samples in buffers, and then you continue over the next couple of days. Yeah. So after that, in the afternoon, I would probably be, either if it's on a Monday, I would have some journal club, or if it's in the afternoon, then I'd be catching up on some reading some papers, yeah, and that type of thing.
Okay, so what was your favorite thing to do while you were doing your master's program? So was one aspect, I don't want to focus it more on experiments, but what was one aspect of grad school that you looked forward to? Like, okay, I must not miss this program or this activity.
Let me think about it. What did I do in grad school? So I would say, while I was doing my master's, so I think for the first 2 terms, I really enjoyed our classwork and my group of classmates. So I had a really good group, good community. So that was something I was always looking forward to. Whether the lecture was long or hard and everything, we would always have lunch or something together. So that's something I was always looking forward to. And I think secondly, being in Oxford is quite a nice city, very traditional, has a lot of things going on. There are these dinners, these formal dinners, or just whether you can have a formal dinner or just a dinner or lunch in the dining hall. So that's something that I also look forward to.
How did you cope with maybe experiences of rejections? I know you know like you mentioned, your master's program was funded, and I don't know if you applied. Maybe you spent a couple of years applying before you got in, or maybe you just applied to one program and you just got 100% acceptance. So how do you deal with successes and maybe failures or disappointments, generally, and maybe with experiments too in the lab? So how do you deal with them?
Okay, so I'll start from my master's experience, which is kind of failure that ended in a good story. So I think the typical route is for most people. There are some people who apply once to graduate school and they get in and they get the funding and they're gone, and that's good. But for my experience, it was a bit different, but it was actually different in a beneficial way. So
Okay.
I first applied to go to Oxford in 2020. So I was supposed to have done my master's between 2020 to 2021, right? But I did get into the course. However, I wasn't able to get funding. And as you know, it's quite an expensive school. So I had no choice but to withdraw from the program. So it was actually very difficult. It was one of like the difficult emails I've had to write to say I can't come because I have no funding. And they don't defer your graduate spot unless you meet like it rarely happens. So that was the only way. So, however, I said it was disappointing, but it was also beneficial because that was the time when I also did a lot of the COVID work that I did. So it was during that time that I then went back, developed myself, got it heavily involved in COVID-19 research. And I think that boosted me and my CV and my networks as well. And the work that I did during that time is probably work that I wouldn't have had a chance to do in my lifetime, you know?
Yeah.
Yeah. So I stayed at home. Well, not at home. I stayed working that year. And then after that, I got geared up to apply for the next year, which is 2020 to 2021 to 2022. So that time is when I got admission. I got onto the course, but I also got funding for my course. And to be honest, it was quite overwhelming. I managed to get 2 funding offers from the University of Oxford, coming from not having funding at all to getting 2, which was quite good. Yeah, so that's how I ended up. I ended up going for my master's, and then for my PhD that's funded by the Rhodes Trust, but also I have some other funding from the Africa Oxford Initiative and the Kennedy Trust Prize Studentship to boost some of the funding for my PhD. Yeah, so that I applied for that for the Rhodes Scholarship during my master's, towards the end of my master's, is when I applied for that. So I think my applications for graduate school were met with some rejections, and obviously I wasn't just applying to Oxford. I was applying to several funding bodies as well, and you do get those rejections, and those rejections, they do hit you. But I think most importantly, how I dealt with that is, number one, I had a really supportive group. And sometimes for me, what works is just taking some time out. So I'll take some time out. I'll allow myself to go through feel the rejection, but I don't stay there for too long. That's always the key. Don't stay there for too long. But get back up, use that time to improve yourself, because now you have time to gear up for the next application. Seek counsel on how you can do better. Yeah. And most importantly, I think rejections, or whether it's a rejection or an experiment not working in a lab, an experiment that you've spent 18 hours on, and then you figure out that you really did nothing for those 18 hours because it all didn't work out. It's never really a reflection of you.
Yeah.
It's not a reflection of you or your abilities and your capabilities. It isn't. And I think that's one thing I always try to remember when I'm faced with rejection. Yeah. I think the second part of your question is then, how do I get, now when you
Celebrate.
finally get what you've been hoping for, how do you celebrate? Yeah. So for me, celebration is making a nice meal at home or going out for a nice meal with friends at a nice restaurant. And most importantly, I will gift myself. I will buy myself something that I've been wanting to buy, that can vary from a piece of cake to something more significant. But I always think it's important to take time out and also celebrate the wins, no matter how little they may be.
Really fascinating perspective. So I think so I think for failure, or something I got from what you said is that you should don't treat it as if it's not yours. So accept, internalize it, but don't dwell there for too long. So stay there a while and then move on. Then for successes, so eat. So when you've succeeded, try and eat if you have to eat,
Yes.
or get yourself a gift. Yeah.
Yeah, get yourself, celebrate yourself, because not people won't ever celebrate you all the time. So pat yourself on the back once every now and then.
Yeah. That's really cool. Yeah. Thank you for sharing them with us. So I think going to Oxford twice is something really, I think it's I wouldn't say it's okay, maybe I should say it's a great fit. Yeah, it's really a great fit that you'd act for someone to get into Oxford twice, for your master's and your PhD, and then also get some of those prestigious scholarships that you've been mentioning. So what are those stuff, principles or motivations, as a perspectives to life and attitudes that you think have, marked your journey so far and, giving you that edge? Because not everybody can get into some of these programs and scholarships, but you're able to get in. So there's something about you. So what's that thing about Marah that we should know about and learn from?
So I think one thing there is about me is I think the first thing I would say is know where you're going. So that applies to everyone, even for myself. And that changes all the time. I mean, where but you have the end goal in mind. Yeah. So it doesn't matter how you're going to get there, but have the end goal in mind. And secondly, I would say know who you are. I think that's very important because circumstances will always change, things will always change. The path might not be always straight, but I know who I am, what I'm capable of, and what I can do. And most importantly, is for me, the principle that guides me is there is a cost attached to everything. If you want to achieve something or do something, there is a cost. Whether that is waking up at 4 a.m. while everyone else is asleep and you are trying to work on something, that's still a cost. Most of the times we don't even look at it as a cost, but it is. For me, in my path, in my career path, that has been combining, for example, my clinical internship and my research internship. So ask any junior medical doctor about a clinical internship, and they'll tell you that it is intense. It doesn't really matter where you're doing it. It is long hours. It is a lot of heavy work, but I knew that I wanted to build and get myself on this path where I'm doing both clinical work and my research work. So it was in that moment I knew that. So say I knock off, I am post a night shift, while everyone else goes at home to sleep for the whole day. I will go home, sleep for some hours, and then get up to go and do my research and immunology side of things. So I think at the end of the day, that's something that I know that there is a cost to anything, whatever it is that you want to do. And that I think if you stay on the path long enough and if you're doing the right thing, consistency pays off. It does. It doesn't matter whatever it is. If you're consistent at it, it will work out. So it can be as simple as reading a chapter. Maybe even a chapter is too long. Reading one paragraph every day. As simple as exercising for 10 minutes every day. So I enjoy exercise a lot, but exercising for 10 minutes a day, it may look little, but in the long run, at the end of 30 days, you've exercised for a considerable number of at least an hour plus. So that's good. Yeah.
So kind of know what you want and where you are going, know who you are, and understand and pay the price. So there's a price attached to everything, right? So if you can't afford it, go and stock up, then go for it.
Yes.
Yeah. So thank you
and
for sharing.
Stay consistent.
Yeah, consistency. Yeah. Sorry, I missed that. Yeah, consistency. Yeah. It's very important to keep doing what you're doing. And so just like I think Tanzanian proverb, little by little, a little becomes a lot. So yeah, consistency is very important. Yeah. So thank you for sharing all of that. Yeah. So I think I think I really love the fact that your research, inflammation is really a, let me say, broad concept in immunology, because it overlaps infectious diseases, it overlaps autoimmune disorders, and it overlaps some other conditions that okay, I think diabetes is also autoimmune related. So it's really an interesting concept in immunology. So in the context of your work and where you see yourself in African immunology in the next couple of years or decades, so what are those things, or what's that one thing you feel like you would want to change or improve in the continent, in the context of your experiences so far, your work from the past to the present to the future? So what are those things, or that one thing? You can mention several or just one in African immunology that you feel this is something we should do better. This is something that I want to, an area I want to make a change in. So that's the next question I want you to address.
So thank you for that question. In the context of African immunology, I just say African science. I think number one, for the COVID-19 pandemic, really gave immunology a chance to shine. Ask anyone right now, they probably know what an antibody is. Everyone knows what it is now.
Yeah.
And we all understand, like, people came up with all sorts of things to boost their immune system or something, or all these things going around. So I think we need to highlight the importance of immunology more. And that's important because at the end of the day, your immune system, as I said in the beginning, it really what stands between you being in good health and you being mildly sick or whatever, wherever you are on the disease spectrum. So I think we, as immunologists in Africa, we need to come up more, talk about more, our work more. And I think also be able to talk about that work in not very scientific terms, which is a thing most of us are not good at. And I guess that's where you come in science communication, because a lot of us are not able to explain. I mean, that's because of a lot of things. I mean, there's in Chichewa, for example, which is the language in Malawi, the only way you can describe an immune cell is like one way, and you can't go into like describing every type of them, but I think it's important for us moving forward. Let's continue talking about the work that we're doing. And secondly, for me, the most important thing is to get more scientists, young people into the field. And I think that plays into the role of the institution where I work at currently, which is the Malawi Live Up Welcome program, but also an initiative that I work with there called the Science for All initiative. So if you ask a lot of scientists, maybe from Africa or wherever, but most of the people that I know, they kind of just stumbled into science. You kind of found your way into saying, oh yeah, there's this field and I want to get into it, and I want to be a scientist, an immunologist or epidemiologist or whatever it is. But most young people do not really consider science as a career. They don't see how they can make money from science, or science being something that they do as a job. So I'm quite passionate about encouraging young people to pursue science. Firstly, be interested in pursuing science subjects right from their primary school to their high school, and then moving on to pursue it as a career. And that's part of the work that the initiative does. And I think this plays into the part that we need more scientists driving local research, so the only way to get more scientists, there's a lot that still needs to be answered, and we need the manpower and the people getting into the field so that we can address these questions together. Yeah.
Thank you for sharing all of that with us. So I think the last point you shared about involving young people, kind of catch them young initiative in sciences. So involving young people, reaching out to them early and helping them to explore science for what it is, science careers, and helping them understand the possibilities in science, right? So I think that's really an amazing work you are doing, mentoring young people to take up science careers. I think it's also a concern sometimes over here in Nigeria, because there are lots of distractions in this generation, and young people, if we don't, if you are not giving them the kind of attention they need, or drawing them to embrace education, embrace science, there are lots of things that they could just get involved in, and just that will not be beneficial for the continent, of course, in the long term. So it's really a great work you are doing, reaching out and helping young people identify or discover career paths in sciences, and nurturing that future for the continent. So well done. And also you talked about the need to amplify the work for scientists to amplify and simplify their work in, of course, as generally as scientists, but also especially as immunologists, because of the very important role immunology plays. So yeah, thank God that we have Immuno-Africa that has stepped up to help scientists amplify their work better. So hopefully, so whatever comes up in the next couple of years or decades, we'll not have the same challenges with communication that we had during COVID. So there'll be better platforms. Of course, we'll have more platforms coming up to amplify science and simplify it. So for the common man, and help people understand how they come into where the roles they can play in science, and of course how science affects their day-to-day life. So thank you so much.
Yeah, that's true. Thank you.
Yeah. So I think the last part of the interview, I'll be asking a fun question. I'll give you a fun task. But I think before we take it, I'm not sure if you have something else you wanted to mention that I didn't ask about.
No, I think we've covered everything. Yeah, I think we've really covered everything. And I think what I would say is that I think growing up in Africa is that there's also a lot of myths about science and who can do science or who can be a scientist. It moves from number one, it also just moves from what we see. Like growing up, the scientist I probably knew was like a scientist I'd seen in a movie or in a film. I never really knew any local scientists. So there's also a lot of myths with now, even when it comes to science subjects in school, they are hard, they're difficult. Men, or they're the only ones who can do well in science. So we have to demystify science as well. It's not this thing that can only be done by certain people, who are exceptionally equipped or something. No, I think if young people know early enough that you can pursue science as a career and they're passionate about it, they'll definitely be able to be good at it and end up being scientists in whatever STEM field.
Yeah. Thank you very much for adding that part to it. So so sorry, before I take the phone question, I was going to ask, as a clinician, I know you've done your internship or housemanship and all of that, but do you still get to work with patients now, or you're majorly in the lab 24/7?
So now I'm not working a lot with patients, but my plan is to go back to patient care. So after my PhD, I still plan to go back to more patient care and clinical specialist training, because right now I'm still at the level where I just did my internship. So I plan to go back and become a specialist, preferably, or most likely rather, in internal medicine and a subspecialty like immunology or infectious diseases in that place.
Or inflammatory diseases. Let me add a third option.
Or inflammatory
diseases. Yeah.
Yes, but it's definitely going to be in internal medicine. I like adult medicine. I don't like pediatrics or children's medicine.
Okay. Yeah. Okay. So I think I think so, that's my opinion. So if I were to ask you maybe what's your favorite immune cell, you probably say neutrophils, because you've been working with them for quite some time. So I'm going to ask you.
No. Go on.
So I'm going to ask you another question. Right. So I'm going to ask you another question. So the question I'm going to ask you is so if you were not a scientist if you were not a clinician scientist like the specialty you're delving into now? So what do you think you would have been? Maybe what dream did you have as a child or something?
I would have definitely been a lawyer if I hadn't been a scientist. If I didn't end up in science, I was going to end up in law.
Wow.
So that was influenced by two things. Number one, I come from a family where three of my uncles are lawyers. So they kind of played into that and wanted me to go to law school. But I decided that I liked biology and science. So I went the other way. So I think definitely lawyer. Now, if you ask me what else I would do with my life if I'm not doing science, I would maybe become a chef. I like cooking, I enjoy cooking and different foods. So maybe I would go to school to become a chef or something like that.
Okay, so I'm going to say two things. So interesting that you want to know, like there was that background or that spur for you to study law while growing up. So, and I think when you mentioned that you probably be a chef, I just connected that. Oh, I'm not surprised. Perhaps that's why you enjoy exploring meals or cooking as a means of celebrating your wins, right?
Yes. Yes.
Thank you so much for the chat. I of course I absolutely enjoyed every bit of it, and it's a good thing that we have individuals like you and several others young people, emerging scientists, and individuals with interest in immunology or science can look up to in the continent to keep going and to just make sure they are exploring their passions and staying true to what they believe in. So thank you so much and keep doing what you're doing. And on behalf of myself and the podcast, I'm wishing you the very best with your career progression. And of course, we are looking forward to all the amazing things you will do. And the fact that, of course, would also bring you here to come and share some of those amazing things. So thank you very much, Marah, for honoring this invitation and talking about your work. Thank you.
Thank you all for having me. I enjoyed our chat, and keep up the good work and highlighting immunology in Africa and the work that we're doing. Thanks.
Yeah. Marah's story has inspired us in so many ways, and one that stands out for me is our response to disappointment. What we make of the challenges we face depends largely on how we see them and whether we can maximize the many opportunities they present for growth. That's my takeaway from this episode. What's yours?
Thank you for listening to this episode on Immuno Africa. If you enjoyed it, please feel free to share it with your network. You will learn first about future episodes and get other immunology related updates by following Immuno_Africa or the Immunology in Africa podcast on social media. See you on the next episode. Bye.